Gigi Sukin with ColoradoBiz magazine. We are here at UMB Bank today, and we are lucky enough to spend some time with Richard Ziegner. He's the Executive Vice President and Director of Healthcare Banking for UMB Bank. Hi, how are you?
Good to meet you.
Yes, nice to meet you as well. Is there anything specific that you're seeing in Colorado's healthcare marketplace that UMB is participating in or just kind of evaluating as models are shifting?
Right. Well, Colorado is a great example of the consolidation that's been going on in the market. The market here in the Front Range used to have a very diverse hospital base, right? Lots of different hospitals, all independent. But since the approximately 2008, 2009, and the financial crisis, and then the Affordable Care Act, you've seen many mergers. University of Colorado is a great example. That hospital system merged with Gooder Valley up in Fort Collins. They work now with Memorial Health down in Colorado Springs. They've announced that they were buying a physician practice up in Longmont. Sisters of Charity is buying a hospital out in Brighton. So that consolidation, again, is really being driven by the Affordable Care Act and the need to gain efficiencies, economies of scale so that they can survive and thrive under this new paradigm.
What are some of your specific goals for UMB's healthcare practice and the new sort of tactics that you will be taking moving forward?
Sure. Well, for us here at UMB, we really see healthcare. Healthcare is a big thing, right? As we said, 17.5% of our nation's economy. So what is it that we're going to focus on here? And really where we're going to put our energies is around providers, healthcare providers. And we really see that part of healthcare being divided into three different sectors. So the first sector that we'll do business with is the nonprofit hospital system. So that entails, again, the 4,900 some odd hospitals throughout our country. Of those, about 60% are nonprofit. And we will do business with the full range of nonprofit hospitals. Everything from a critical access hospital with 25 beds that is in rural America someplace to the large multi-hospital, multi-billion-dollar revenue hospital system inside of a large metropolitan area. So we'll do business with that whole range of hospitals, and quite frankly, many of our competitors won't. So that's a really nice place for us to do business. The second sector that we'll look at is long-term care. And as I mentioned, there are about 15,000 long-term care companies throughout the country. And that's a rapidly growing sector of healthcare as people age. There is a large piece of that is for-profit and then a large piece not-for-profit. We'll work with both. And then lastly, there is the physician practice medical enterprises space. And most of that is for-profit enterprises, large physician practices, specialty hospitals that are maybe doctor-owned or investor-owned, could be the clinic down the street. Mainly, though, focused around for-profit entities. So we'll do business with all four of those segments. Over the next 12 to 18 months, what I'd like to do is to build my healthcare team. And for me, that means we're going to have healthcare relationship managers that will be scattered throughout our footprint. And those relationship managers will be UMB's primary point of contact with our healthcare client. They will be experienced in the healthcare space. They will have expertise around healthcare and providing capital and financial resources to their healthcare clients. But most importantly, they'll be passionate about healthcare, right? They have to live and breathe and really love working in the healthcare space. As important as that is, I think one of the other things that's going to be very important for UMB in our success in healthcare is our ability to kind of reach across the bank and bring different groups together to provide financial resources for our clients. So whether it is my team providing capital to a healthcare entity, it may also entail treasury management. And UMB Bank has invested tremendous resources into building treasury management systems that help healthcare entities move money into their organizations and out of their organizations better, faster, cheaper. And so we will have healthcare specific treasury consultants that work with nothing but healthcare entities, helping them figure out how to move their money in more effectively, more efficiently. We'll also work with our public finance investment bankers, so that when I'm working with a nonprofit hospital or long-term care facility, maybe the right answer for them isn't bank capital that I would provide, but maybe instead it's going out to the public market and doing some sort of a public offering to get public capital. So I will work, again, side by side with those public finance investment bankers so that we can bring the best financial solution to our customer, whether it's bank capital or market capital. I'll also work with our asset management team so that we can help our clients invest their idle funds. And I'll work with our wealth management folks so that we can provide a very high-touch, high-level private banking experience to our senior executives and owners of some of our businesses. I've been at UMB now for just about 4 months, and I can tell you one of the great things I am really enjoying about this bank is that we have so many capabilities that all of our big bank competitors have, and we're willing to provide capital and financial services to the healthcare sector. But what we do differently is that we're still a community bank, and we put the customer at the center of everything we do. Not a day goes by that me and my colleagues aren't talking about how we provide our clients with the unparalleled customer experience. And that relationship management model, when married with the abilities and the experience, the expertise that a healthcare specific team can bring, I just can't tell you how excited I am about the future and building a wonderful business with my UMB colleagues.
Richard, thank you so much. This has been really informative and wonderful.
It's a pleasure. Thank you.
Thanks.